Now for more coronavirus pandemic questions answered, the federal government now is classifying all COVID-19 patient deaths as such, regardless of whether any other underlying health issues were a factor. This as the death toll in the United States just topped 13,000. How many of those people had other health risks at play, though? And maybe it wasn't, in fact, COVID-19 that caused their death. Dr. Deborah Birx, with the task force at the White House, explains it this way.
Some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it. The intent is right now that if someone dies with COVID-19, we are counting that as a COVID-19 death.
Medical panel now. Dr. Devi, Dr. Bose, Dr. Nesheiwat. Dr. Nesheiwat, I'm going to start with you. What is the significance of this?
Well, it gives us inaccurate information because just because you have coronavirus does not mean you will pass from it. You could have died from a heart attack. For example, one of the leading causes of deaths in diabetics is heart disease. And just because you acquire a coronavirus does not mean that that's going to be the cause of death. So I don't think it's going to be a huge discrepancy in the data in the end, but it definitely will give us some false numbers, some inaccurate numbers, but I don't think it's going to be a significant difference.
Thomas B. has this question. Let's watch together.
Hi, my name is Maria. I'm from Wisconsin, and I'm just curious. I take 2 preventive asthma medications, and I'm wondering if that would help me prevent getting the coronavirus.
Obviously, that was not Thomas B., which is what I had called for, but it's a great question. Dr. Bose?
We're still learning more about COVID and how it affects asthmatics, but from the emergency department point of view, a couple of points that may help. To answer her question, or his question, I don't think that actually, it prevents you from getting COVID. But one thing we're finding is the nebulizer machines that asthmatics use, they actually can spread the virus all over the room. And here in the emergency room, we're worried about that too. So that affects the family members and the loved ones of the asthmatics because you don't want the COVID particles aerosolized everywhere where it can be inhaled by others. Other than that,
I gotta
just like anybody else, stay healthy.
A lot of people with young children, and I've seen it, use those nebulizer machines. Sometimes they'll get a bronchitis that they can't get over. It doesn't mean they have asthma, but they'll get albuterol or whatever in that machine. How does that spread COVID-19?
Well, you're aerosolizing the particles, right? So that's essentially what you're doing in the nebulizer machine is you're putting the liquid albuterol or whatever medicine that is, and it's turning it into a fine mist that you inhale. But if that mist is mixed with coronavirus, that mist is going everywhere. And then the loved ones, what we're seeing in the ER is a lot of people who are getting infected have someone who's sick in the house. And especially in asthmatics, aerosolizing that can be high risk.
All right, Jack J asks, why not suspend HIPAA rules so that the names of those infected can be published? That would allow people to immediately know that they have been exposed. Dr. Devi?
Well, there are 2 things there. So first, you don't want people who've been exposed to face consequences themselves, like to be stigmatized or to have people harass them. So generally, we want to respect patients' privacy. But I do agree that some of the HIPAA rules are making it difficult for doctors to share data and to get information as quickly as possible. I think also if HIPAA was relaxed a little bit, then the media would be able to get a better picture of what exactly is going on inside these hospitals and why it is so important that people are staying home and flattening the curve.
Doctors, it's been great to have you on this hour.